Good afternoon, everyone, and thank you for joining us today for the January Telehealth Learning Collaborative hosted by the North Country Telehealth Partnership, which is AHI and Fort Drum Regional Health Planning Organization. We're going to start the meeting with our regulatory updates, and we're going to start those off with a quick update from Kendra Muckle at DOH. You able to? Oh.
Hi, Nancy. How are you doing?
Hi, Kendra. Great. Thank you for joining us.
So as I said in my email, there's not a lot to update on the DOHN just yet. There's a lot in the works. Our post-pandemic regulations are working their way through the executive clearance process now, and we're all very busy working on telehealth policy, and we just can't really report out on anything until after our regulations have been finalized. But we do expect that they'll be hopefully posted for public comment sometime in February. I can't guarantee that, but that's the goal at this point.
Thank you, Kendra.
Thank you.
We'll move on to our Office of Mental Health updates from Amy Smith.
Good afternoon, everybody. Just a really quick update from OMH as well. We had our most recent amendment to our commissioner's waiver, which was effective and is still in place as of December 7th. And we also are finalizing or, getting our final public comments in on the emergency reg for Part 596. So we'll be reviewing any public comments that have come in. If we need to make any substantial changes, we will repost, but if not, we will move towards final adoption of Part 596. And we're also working on updating our guidance documents to go along with that as well. And that's it.
Thanks, Amy. And we'll move through to the Office of Addiction Services and Supports, and we have Kelly Grace on the line for those.
Hi everyone, this is Kelly. So super similar to OMH, our telehealth regulation has reached the end of its public comment period. It was out as an emergency proposed rulemaking. This week marks the end of the public comment period. We actually have not received any additional public comments that we need to address. So the adoption package will be moving forward later this week. And again, similar to OMH, we did extend our commissioner's waiver back in December, and we'll also be working on guidance. And that's it.
Thank you so much. So of course, for the group, I will keep an eye on all of these pending new regulations, any documents that are published, and I'll share those with the group as available. And we do not have any updates from Tony from CMS, but we do have him on the line. If there are any Medicare related questions, feel free to pop anything in the chat or the Q&A and we can address those after the call. Same for our state representatives. If there are any questions, feel free to drop those in. But with that being said, I'm going to stop sharing my screen and I'm going to turn over presenter mode to our featured presentation. Chris, you should be able to share your screen now, and I'd like to introduce Chris Gower of Vital Care Services, who is going to be presenting on remote physiological monitoring.
Hi, good morning, everyone. Good afternoon, everyone. Just wanted to introduce myself briefly and go through the agenda that we have for this presentation. So thank you so much, first of all, for having me. As far as the flow of the presentation, after I just speak a little bit about myself, wanted to talk a little bit about the benefits of remote physiological monitoring for patients and clinicians and using digital health technology to this point. A little overview of what those technology and services could look like, a little bit more about the reimbursement structures that are available for providers to provide these services to their patients. And then after that, we found it important to give some real life case studies that we have to kind of share some of the insights of how some of these technologies can really make an impact on patient lives as they're monitoring their health and well-being from home. There's also some new codes that are just introduced for 2022. So I just want to give a quick overview of what some of those codes look like, all of those which are looking to be pretty encouraging. So I hope you can benefit from that. And then just some key takeaways, and I wanted this to be interactive where we can get some questions as well. For digital health technologies and programs to really succeed, it needs to have a lot of engagement from the different, all the parties that are involved, from patients to providers and of course payers to help reimburse for these services to be there. So with that, just a quick introduction about myself. I've co-founded Vital Care Services with my brother, Dave, about 10 years ago. We're based out of White Plains, Westchester area in New York. And essentially why we started the company was just to do digital health technologies in a very personal way that's really important to make sure that patients really have technology that's easy and to use and giving them meaningful information, and as well as connect them to providers and insert that technology and really make sure it fits into their workflow and gives them impactful metrics to help them in their patient care, as opposed to being a burden and more work and more cumbersome to the busy schedules that they already have. So I've been really fortunate to work our avenue with this company, and have done a lot of great work at the county, state, and federal level, working on various different programs. These remote monitoring codes have been a big initiative of ours to continue to expand what we do. And my hope in this presentation is just to help disseminate some of the information that's available to either your patients or friends and family or whoever who could benefit from having some access to more digital health technology in their homes. So with that, I'm just going to go over a little bit more about the benefits. Remote physiological monitoring is essentially connecting patients and providers and using technology in some fashion to connect them. Oftentimes it's to transmit vital signs or answer questions to health-related questions, virtual visits, text communication back and forth, and having more connectivity. So starting just actually 2 years ago, and previously before that, there's been slowly rolling out more and more evidence to show that remote physiological monitoring can really impact long-term health of patients, especially those over 65. So there's several CPT billing codes that are available. Some of you on this presentation may have heard of them before. Some of this might be for the first time. So my goal is just to kind of give you a little brief oversight of what the benefits are and go into a little bit more of the specifics as we go through. Specifically with patients, this is just some insight that we've gained over many years of just working hands-on with individual patients, and surveys, whether they be formal or informal. We really find that patients start to increase their health knowledge and awareness of their health, and what we oftentimes use as the term is activated in their health, which can really play a big role in changing the trajectory of how patients take care of themselves, especially in those crucial years after 60, 65 years old. And with that connectivity to their providers, they feel that they're more connected to their medical provider as opposed to just seeing them once a year, twice a year, once a quarter, as usual, without any kind of technology connection between them. And then, of course, improved health outcomes with early intervention and some care coordination in between, with nurse monitoring and other types of modalities to monitor patients. And as we go into with the clinicians, we find that as we've worked with and trained nurses and doctors and other providers using the web portal to actually see that information, we really find that a lot of providers, when they have a successful program, they feel that their patients are more compliant with their overall care plan, that they're more satisfied with their relationship with that provider, and actually promotes loyalty to that provider / practice. and also can ultimately help improve their outcomes. And what's really been a missing component up to a couple of years ago was that there was no billable codes that a practice could use. That has changed, obviously. So we're going to go through that in a little more detail. And then a big barrier in the past has been increasing workload, and just some of the things that we try to do to overcome those obstacles to adopt or scale those programs is some of the streamlined processes for catching alerts and reporting to the physician office. Oftentimes, having one of our nurses help do the frontline triaging of all the alerts has been a really essential and needed service to not add more clinical time on a day-to-day basis to the practice. Here's a quick overview of how the technology works to enable those. We kind of break it down into two parts. There's the technology component, which is all the hardware, software component to it. And then, of course, the missing services side, which is really a part that is often missing to actually have a program really sustain itself and actually grow. So just to start with the technology side, as you can see on the picture on the left, this is an example of the briefcase that a lot of our patients receive. We, of course, have a cellular enabled tablet with high-speed internet already built into the tablet, so we don't have to worry about Wi-Fi or any kind of connectivity issues for the patient. Some medical devices, such as a pulse oximeter, blood pressure monitor, a weight scale, as some of the core components, and then some new devices, as well as a glucometer, a thermometer, and other types of metrics. What's really convenient for that the patients and providers like is that when they receive it, it's already been prepared and set up for them. So there's no pairing or any type of really virtual setup. It's already been set up for them. So it's very easy to use right out of the box. And then some other metrics that can be captured as needed basis per patient, pain levels, mood levels, fluid levels, other types of metrics that can be customized per patient. And then, of course, the questionnaire feature is pretty intricate with specific disease questions that could be asked, such as clinical, social, and behavioral health type of questions. With the benefit of a tablet, you're able to do on-demand or scheduled virtual visits, and that's been really helpful for different agencies to have that connectivity, especially as we're going through the pandemic. Outside of the technology, there's the services component, which we see to be very important to offer. So some of those include, as I mentioned before, a nurse that we have covering 7 days a week of all the alerts that are coming in. They're able to triage those alerts, contact the patient, and bridge the gap with the provider when there's any escalated alerts that have to come. Of course, the patient boarding is really important to make sure that patients, especially those over 65, feel comfortable using the technology. So we have a pretty intricate process to really make sure that we reach out one-on-one with those patients to make sure they expect the package to arrive, and that they actually have the personal attention that they need to make sure they're comfortable using the equipment. So that's been showing to be really important to help adoption and acceptance and long-term compliance. And then a missing component also sometimes is with logistics, as far as outbound shipping, when the patients are done with their program, to have it come back, to fully sanitize it, test it. Those are just some of the logistic services that we also offer there. And also technical questions. We don't want to burden clinical providers with patients calling for technical questions. We serve as that bridge to help those technical questions as they do come up. So the patients are instructed to call us directly if there's any kind of technical questions with the devices or anything technical. And then, of course, just project management oversight, making sure that the partners that we work with have the right metrics for success in sight, and making sure that we're making a meaningful impact to the practice and their patients in the program is really important. So we found that healthy balance of technology that's easy to use and collecting meaningful information is important, but also equally the services to really make sure that it's delivered, it's meaningful, it's easy to use, really minimizing any kind of technical barriers to get those information. So that's really important there. This slide is just a little overview graphic, and as I know, this is going to be sent as a PDF as well, so you should have access to these codes These are just some of the codes that we've used working with several early adopter providers to really make sure that they're working properly and develop a workflow process. But as you can see, there's a code available for training and delivery of the equipment that's 99453, for example. And then there's a couple codes that cover the actual technology portion, 99454, for example, and then the actual clinical time of the provider, the billing entity, which is typically the medical practice. And that's the core 99457. And as additional for patients that are requiring more time, 99458. There's also another code 99091, which is available as well. So there's several different codes based on the patient's needs, different qualifications, and hopefully this chart gives you a little sense of that. And as you can see, that it varies based on the patient's health payer plan. But in our experience, we find that monthly reimbursement collectively between 99454 and 99457 typically is about $123 to $167 per patient per month, which we believe in our experience has coming to be a reasonable amount to cover the technology costs and the provider's time doing the monitoring. What's really important here is that about 20 minutes of clinical dedicated time from the provider is needed. And that is anything from reviewing the data, documenting, contacting the patient as necessary. And we find that in several of our different early adopter providers and real-time feedback that we've received, that personal interaction in whatever modality between provider and patient really helps engage those patients and really make them feel like a sense of staying connected to their health and be able to submit their vitals on a regular basis. And that's evidenced in several patients that we've had for multiple years, still staying engaged. It's built into their routine to take their vitals and stay engaged with their provider. Couple case studies I just wanted to share. There's so many of them that I couldn't contain into one slide, but we found that kind of grouping them into three main categories can be helpful, such as some of the outcomes such as health awareness, health activation, and in some of the most extreme cases, avoiding potential health emergency events. So just a quick overview of what those are. These are real people that we've had over the past several years. For health awareness, we had a 65-year-old male in New York City who did not know he had hypertension after a successive couple readings that were taken through our devices and are escalated to our nurse. The nurse really worked with that patient to help them get a PCP visit and prescribe medication. And it was just really positive to see the diagnosis appropriately given through the doctor's office, medication to help him become stable again with his blood pressure. And that's so important, especially when symptoms aren't always, in this particular case, it wasn't physically showing any physical symptoms, but however, his blood pressure was quite elevated. We also had the blood pressure cuff, for example, also brings heart rate as well as a metric. And we had a 72-year-old female in Long Island, New York, who had a very low heart rate into the 40s, very low heart rate. And that also prompted a nurse intervention to get the patient to their PCP. And eventually, after several follow-up visits, a pacemaker was put for her, and she's been stable since then. As far as health activation, this is really important too, because a lot of times when we work with patients, they don't have necessarily a health routine. And we found that our system really helped added structure to this gentleman's routine. And that's part of our coaching process as we get them set up. We find a convenient time for them to do it and really encourage them and coach them to make it part of their routine, to check their vitals after taking their medication, having breakfast, etc. And we took a patient who was really kind of not interested in the program to really encourage him. And he started to really take vitals daily. And he really attributes a lot of his health activation and awareness to that. This other one is pretty interesting as well. There's a lot of people who are pre-diabetic, and we had a 60-year-old male in New York City who was in the program. He knew he was pre-diabetic, but it really didn't have a really concrete care plan to really get him to avoid diabetes. And this really activated him to bring more awareness to his diet and exercise, because we do take blood pressure, of course, and body weight and other types of metrics. And within about a 9-month period after seeing his doctor, um, he was able to be no longer pre-diabetic or requiring medication to control his sugar levels. His A1C came back to a normal level, which was pretty great. And the final category is just avoiding health emergency events. It's not as frequent that we see these firsthand, but they do happen at a decent rate. A couple of examples: we had a 64-year-old female in Long Island, New York, very low pulse oximetry reading and repeated. It was still low as well in the low 80s. Prompted a doctor's visit, and we, with multiple chronic health conditions that this woman had, they said this was a really important catch, that we were able to catch this low reading and have appropriate intervention and avoid an emergent health condition. And then lastly, in one of our community programs here in Westchester County, there was an elevated blood pressure reading that was in the severe range. Validated it with 2 readings in the community. The site administrator requested to get EMS services to have a further evaluation, which confirmed that elevated blood pressure, and was brought to a local hospital for further follow-up. So hopefully that's helpful. Just a couple of our recent case studies that kind of humanizes some of the benefits of what remote physiological monitoring can do. Like I said, there's many more, but just wanted to kind of share a few of those with you. And as we're kind of wrapping up here, some of the new codes which were new to us in the last quarter of last year, was doing some research on them. It's very encouraging to see not only the RPM codes continue, as I had mentioned before, but some new codes as well. A new term that CMS is calling remote therapeutic monitoring. And it's just covering the management of respiratory system status, muscular system, therapy adherence, therapy response. And this could open it up to more providers such as PT, OTs, speech, social workers, psychologists, etc., to use these codes. There must still be direct supervision of clinical staff who are providing if the clinical staff are furnishing these services. What's really important about this too is that they say non-physiological data may include self-reported data, like such as answers to questionnaires. So that could be really helpful for more than just clinical monitoring, as we've shared earlier. It follows the same structure of billing codes, where there's a code for a one-time setup, which is 98975, and then there's technology code, and of course the professionals time. So it's following the same model with similar types of reimbursement amounts. And I included the link to the 2022 physician fee schedule for some more information. And we're looking forward to continuing to work with different providers who want to pilot out these new codes, and even at a smaller scale, really see if it's something that's viable that could help practices and help patients ultimately. And as I'm kind of wrapping up, I just wanted to share a few key takeaways. A lot of the discussions really come around the payer, the provider, and the patient. And I really believe, especially through the pandemic, which has kind of really guided patients to be expectant to use technology. They're used to using technology, and similarly providers. I know we have a lot of providers on this meeting as well who have used virtual visits with their patients. It's becoming more commonplace, and it's been amazing to see how much, even in just our 10 years, the adoption, the word telehealth is a lot more mainstream now as well, and that's going to continue to improve and continue to scale. And of course, one of the very crucial points for these programs to really adopt and scale is payment, of course, and those payment codes are available. And our goal really is just to really help disseminate this information to different providers and ultimately help patients. I've had hundreds and hundreds of patients that I've worked with that really helped benefit from access to convenient technology in their homes to get a sense of how their vitals are doing and stay connected to their provider. So we really believe that it's going to continue to grow. And we're really open to continue to have real conversations with our providers and really make sure that this type of a program really fits into their workflow and gets those outcomes. And really, we're very committed to really tailor those, services around there to make that work. So, with that, I just wanted to open it up for questions and answers, and I had shared my contact information here as well. Always happy to have some conversations and just share some of our experiences. My overall dream is to really hope that digital health technology and telehealth types of services continues to expand. I hope the momentum from the pandemic continues to grow as far as adoption and payment for remote type of care. And we're very excited to see where the outlook is going moving forward. Thank you so much for your time. I hope this was helpful, and we'll open up for Q&A.
Thank you so much, Chris. Yeah, as a reminder, anyone that has not submitted a question yet, feel free to pop those right into the chat or the Q&A boxes, and we'll relay those to Chris. And I did get a few in privately, Chris, and I know that sometimes our participants will directly message you as the presenter, so I'll ask you to just check on your end, but I have a few that we could start with.
Sure.
The first question that came in is, are patients trained in their homes via visiting nurse, or does the patient have to train at a healthcare facility?
That's a great question. It could be done either way. In a lot of our experiences working with home care, for example, the trained visiting nurse, we ship the equipment, for example, to the home, but the trained visiting nurse provides that essential in-person assistance, which really helps patients. Or if the nurse is not available, or there's no nurse available or trained professional, it's easy enough that patients do set it up themselves with telephonically or with the guide of any kind of help from our end. So it really depends on the program and what resources are available to the patient. But in our experience, the general public is able to follow the instructions, and it's very user-friendly and very easy to use. But we're open. We've had other times where the patient sees a demo kit, for example, in the physician office, and that's really helpful sometimes, just to kind of introduce them lightly to how it looks like, so when they do receive it, they're familiar with what it looks like.
Awesome. Thank you. The next question is, do you have any insights on the status of getting federally qualified health centers the ability to bill for RPM? Do you happen to know if that's part of any of the legislation currently moving through Congress, such as Bill 6202?
I don't myself have a lot of knowledge on those specifically. I've had a lot of firsthand experience with these RPM codes specifically. I know there's separate funding channels that could be available for those specific types of practices. So I apologize, I don't have that specific answer to that type of practice. I just really have a lot of more experience on the traditional Medicare side from CMS.
Thank you.
Yeah.
Can you share the average cost of a unit?
Sure. With a lot of our providers, they could either buy the unit together, prepared and everything for you. And that's roughly about between $800 and $1,000 per unit, or it's leased on a monthly basis. And that ranges from about $50 to $65 per patient per month, depending on what configurations they have. So it really depends on which devices they need. We've had some programs with just a tablet and blood pressure cuff, which is a lot less, or if they need more devices, it really depends on the scale of the program.
Great, thank you.
Mm-hmm.
Do apps or patient portals constitute as a device in reference to the setup CPT code?
The setup CPT code is really meant to allow some resources to help the patients set up their equipment. So to my knowledge, that really helps cover the time it takes from a personnel to not only ship the equipment to the patient's home, but to actually help them set up and use it. That could theoretically be done, again, in the patient's office as well, in the doctor's office. But we found in our experience, working directly with the patient outside of the clinical setting seems to be working pretty well. But as far as using for a patient portal, that's not where it's been in my experience. It's
Thank
really
you.
more for setting, yeah.
The final question we have on our end is, do you have any examples of using your program for pain management?
Yes, we actually have a post-surgery program from one of our providers in Long Island, and and if they had different surgeries, such as like an appendectomy or hernia repair or pain management, and rating that level is really crucially important. That's something where it's been really helpful to really complement the other vital signs and questionnaires and other types of data that's able to be collected to really make sure that the person is feeling well, that the pain medication is working properly at the right dosages and everything. So yes, we had a recent program through an FCC funding with a provider in Long Island, and we did a program for a shorter duration post-surgery, and rating pain levels was really important. So we had that.
Great, thank you. That was
Mhm.
the last question I have on my end. I'm not sure, Chris, if you have any privately in your chat. You can check that out quick.
Nope, nothing else unique.
All right. Well, thank you so much, Chris. We will move on with our agenda for additional telehealth updates, but oh, we actually just saw one come in. I was going to say we could always circle back to the chat, but one
Oh,
just
sure.
popped in. Do you see this being used by any behavioral health or substance use disorder providers?
Yes, I think this could be really helpful, and I'm hoping that we can continue to work with behavioral health. It's a growing need that's out there, and participants are starting to get. There's a lot of data that could be collected from the home setting in behavioral health type of management, um, and just such as rating mood levels, rating response to medication as well, and other types of metrics. That data could really help inform providers, psychologists, psychiatrists, other mental health providers, behavioral health providers that might have not really been tapped into before in a streamlined way, in a scalable way. So that is one of our initiatives, is to try to work with different behavioral health providers with these new codes. The remote therapeutic monitoring specifically is something that has spurred a lot of interest and conversation between my team. And we're really looking forward to just new providers that we could test it out with and really, even at a small scale, really learn how the process works and really try to customize it, see if it could really help. So I think there's a lot of applications in behavioral health, and we look forward to those opportunities.
Awesome. Thank you so much. I'm just gonna pop your email into the chat once more, just in
Sure.
case anyone um, has any follow-up questions.
And
And
all my
again,
contact info is on the last page of the
right,
PDF that you guys will be
exactly.
receiving.
We're
So.
going to be sharing the PDF of these slides that will have further contact information and website, of course, but just posting that now so everyone has that. Thank you
Thank you so
again,
much for your
Chris.
time. Really appreciate it.
Yes, this
Hope
was
to have some other
great.
conversations moving forward, and then we can all continue to help really scale these programs. And those conversations in our community and our providers is so important. So I would welcome anyone to share and just have a quick conversation after this. I would love that. Thank you.
Thank you so much. Switching gears, I'm just going to reshare the agenda. We have a couple of more updates, and Bob Hunt from Fort Drum has the first update for the group. Can't hear you, Bob.
Okay, can you hear me now?
Yes.
Okay, so FPR HBO has been able to procure and will be distributing this week 445 oximeters to regional hospitals and primary care offices to implement the BORROW program for high-risk patients with COVID-19 or other illnesses and chronic diseases that result in respiratory illness. We've also printed and will distribute instructions on their use and a tracking log. Patients, of course, should take the reading at least once in the morning and once at night. Directions on what to do if oxygen levels are at or below 90 for more than an hour. Samaritan Medical Center has had this program in place for some time now, so we're giving many partners across our tri-county regions the ability to provide this equipment to patients so that they can monitor care at home with the hope that patients will be empowered to seek the care at the right time. And of course, that's all on your screen, and you can read that for yourselves. And if anyone wants the instructions, I believe those will be included as part of the PDF that goes out after the call.
Thanks, Bob. Yeah, that's very exciting news. So again, I'll post the directions that will be going along with those with the meeting notes that will be distributed tomorrow. Just a few more quick things that you might have seen in the agenda that I've sent out with registration. There's a new funding opportunity through HRSA, the Rural Public Health Workforce Training Network. And that program specifically calls out health information technology and telehealth. So that's a great opportunity, and we have the link in here. Deadline for applications is March 18th. So I implore everyone to take a look at that. The FCC released their next round of funding on December 21st. I'm sure everyone has seen that by now, but wanted to include that. The CMS did release an updated state Medicaid and CHIP telehealth toolkit in the past couple of months. So it's always great to see newly released pieces, documents, and guidance for our partners. So that link is also included. The Center for Connected Health Policy released their 2021 state legislative update for telehealth a month back or so. I have the link included as well, and I implore everyone to take a look at their website. If you don't already, they are very great at updating everyone on all things telehealth policy regulation. I put this in here and the deadline has passed, so but I did call it out in my email previously. But New York State has the new telehealth capital program. Those applications were due on the 18th. That's a great opportunity that I hope our partners took advantage of for applying, and hopefully some more information to come in the future on that great opportunity. A couple of upcoming events. The Northwest Regional Telehealth Resource Center is holding a webinar on the 26th on Wednesday, Telehealth Breaking Down Provider and Patient Barriers. You'll see the registration links for all of these in the notes. On the 2nd and 3rd of February, the National Technology Center, funded through HRSA's telehealth agencies, is hosting a telehealth technology assessment, building tomorrow's virtual healthcare with today's technology, and that'll be a great event. AHI is hosting a webinar with our HRSA RCorp program with New York Matters, and it's a webinar on MAT and electronic referrals. And the presentation will review telehealth MAT services and the referral platform NY Matters offers. And I'm going to attach a flyer for that webinar with the notes as well. And just a couple of save the dates. We are going to be hosting a couple of educational opportunities coming up in the spring and into the summer. On April 5th, we're going to be hosting a webinar on a tobacco cessation program. So that should be really interesting. And of course, I will be blasting out this information as we get closer to the event. And on June 7th, we're going to be hosting a webinar focused on telehealth for population health initiatives. And these are in collaboration with the Adirondack Rural Health Network program. And hopefully we have a few more moving into the summer and fall of 2022. So keep an eye on that. And finally, just a quick update. We don't have too much information on it yet, but AHI has recently been awarded funding through the New York State Digital Inclusion Fund. And with that funding, AHI, alongside our partners at Fort Drum, are going to be convening a digital inclusion coalition for the North Country, really focusing on digital equity and for telehealth access for our communities. So we're really excited about that. We're in the early planning stages, but if any of our partners in the North Country are interested in joining this coalition, we'll have some monthly meetings, and I'll just put a quick note about that in the notes as well. But again, this will be a newly formed digital inclusion coalition by the partnership, and that'll be really great. And we hope to have some more updates from that group at our next Learning Collaborative call. I'm not seeing any other questions, but I'm going to open it up for one more minute if there are any questions that come through. Oh, I do see one. Can we be forwarded a copy of these web addresses for updates? Yes, all of the links to everything mentioned will be included in the email I send out to all registrants. And again, YouTube link from this presentation will also be included with the meeting notes. I'm going to quickly just remind everyone of our next meeting. So our next Learning Collaborative will be on March 21st from 2 to 3, of course. Of course, I will be sending out a reminder, agenda and everything. And just another plug for the remainder of 2022, we are always looking for presenters or topics that our partners want to hear of for our Learning Collaborative. So if there are anyone interested in talking about your programs or any topics you would like us to focus on with upcoming Learning Collaboratives, please let us know and we'd be happy to make that happen. I'm not seeing anything else in the chat or Q&A, so I think we'll let everyone get 15 minutes back in their day, which is, I think, always appreciated. I want to thank Chris one more time for his presentation and thank everyone for joining us today. And I hope you all have a wonderful day and week. Thank you.
Thank you, everyone. Take care.